I'm Dr. Boyle. I did my medical school training in Calgary, Alberta. I did my residency training in London, Ontario, although I did spend a year in St. John's, Newfoundland, doing a rotating internship. Urologists are surgeons first and foremost, but they also treat diseases long-term. They see patients from the time they're born until the time they die, and they don't just operate on them and then discharge them and have them followed by another specialty. They manage some of their own oncology patients long-term in prostate cancer, and I like that long-term follow-up of my patients. Within urology, I'm passionate about cancer, and I did a 3-year fellowship at the National Cancer Institute to develop my skills in urologic oncology, surgical, medical oncology practice of it, and to really develop the skills in caring for these patients, but also to do some research on top of that. The most common things for urologic oncologists to see are prostate cancer, kidney cancer, bladder cancer, and then we also see testicular cancer as well as penile cancer. When I first sit down with the patient, I sit down and I'm there to hear your story. I'm there to talk to you about what you know and where you are. And the reason that I do that is because everyone comes from a different background and everyone has a different understanding of their disease. And I think it's really important as a physician, and in particular as a physician who's treating oncology patients, to really understand where the patient is at with their disease and their disease process, as well as their understanding. I think it's really important that patients don't leave thinking, oh, I wish I had asked. I'm always available to be there to talk to my patients and answer questions on a timely basis. And I think it's important because it's tough dealing with cancer. One of the reasons that I chose to come to UNMC was because there is the opportunity to have an academic practice here. And I think academic practices are slightly different. It allows me the opportunity to do research about cancer, how cancer works, what drives it, how we can find new treatments for it, better ways to fight the cancers using some of the tools we already know exist, and really improve patients' lives through that research. But it also lets me teach. I'm incredibly passionate about teaching. I like to think that we are shaping the next generation of urologists. And I think that's something that is really a responsibility of mine towards the specialty of urology, to train the next generation and teach them how to do what we do.